Chair recognizes Dr. Cassidy from Louisiana for 2 minutes for question.
Hey, thank you, Mr. Secretary, Madam Secretary. I'm sorry. In your answer to Mr. Shimkus, did you really mean to say that the Affordable Care Act has not resulted in increased premiums for the non-subsidized?
Sir, what I said is preventive care.
No, are
doesn't
premiums
add
higher?
to the cost of premiums overall in terms of the long-term health costs.
You're ascribing it to the
our description was.
You're ascribing it to the preventive health care aspect. Okay.
That's what he asked me. That's what I answered.
Now, Jonathan Gruber, one of the architects of this bill, has said that this bill is basically income redistribution. Now, obviously, there are the taxes that are $1 trillion over 10 years, but there's also the increased premiums that people are paying for their policies if they're not subsidized. Do you have an estimate of how much increased, what is the amount of increased taxes increased premiums people are paying to subsidize others on the exchange?
No, sir, I don't, and I think you can only talk about increased premiums, and I think Dr. Gruber would be one to suggest this if you compare like benefits to like benefits.
So let me go on. Danny from Baton Rouge is losing his coverage. He says that this is my apocalypse now. The company I have, my family coverage went up 371%. Monthly premiums for a family of 4 from $245 a month to $913 with a $4,000 deductible. Wow, I think Danny would like to choose his benefits as opposed to that. Many small businesses, according to your office, are going to lose their benefits. As many as 66% of employers, according to your analysis, will lose their grandfathered status. Do you think administration would support my Employee Health Care Protection Act, which would allow workers to keep their group health care plan they have now in 2014 and beyond?
Sir, as you know, the snapshot is not our office estimating anything. It was a description of the turnover that existed prior to 2010 in the individual and small group market, those statistics that you cited. And I think in, again, the small group market, there are lots of plans that are grandfathered. There are other plans that are offering transition and early renewals, and we're watching that every day.
Thank you.
But could I get an answer to my question? Will the administration approve the same law that's given for the individual, that if a small business wishes to keep their policy, they would be allowed to do so?
The President's suggestion about a transitional policy applies to both the individual and the small group.
Beyond 2014?
Gentleman's time's expired.